Christina.
Great. Thank you, Mr. Carr, for the nice introduction, and thank you to Associate and partners for welcoming GAIN to this very interesting webinar. I'm looking forward to being on the panel with everyone. So I'm going to spend a few minutes talking a little bit about trying to define maybe the area of workforce nutrition. This is something that GAIN's been working on for some time. And then spend a little bit of time talking about a few programs that we're involved with, including with Associate on tea plantations in India. And conclude with a bit of a call to action or some information about how we can come together, those who are interested in this area, and move forward this agenda. So I think Mr. Carr eloquently spoke about why it's important that we address workers' nutrition, but this is a little bit more of a pathway around it. We do know that I'm sure you're all quite aware that malnutrition is pervasive. It affects 1 in 3 people around the world, regardless of economic status, across all worker types. This is in the form of undernutrition, overnutrition, as well as concurrently often micronutrient deficiencies. We also know that a vast majority of the world does come to work. They spend 1/3 of their time at work. And so the workplace and the work environment is a good entry point to reach workers and address issues around nutrition. We know that issues of short-term undernutrition, inadequate energy, low blood sugar levels, as well as long-term poor diets in the form of micronutrient deficiencies and others, all have effects on an individual's capacity to work. This is both physical and cognitive. And this has implications on an individual's ability to, first of all, be healthy, but also on their livelihood and in terms of earnings, in terms of household income, and at an aggregate level towards farm level income, business level, and as mentioned before, at the level of the country in terms of GDP. So last year, GAIN conducted a review of the literature on the types of programs that employers are implementing to address the nutrition of workers. And based on the evidence, they basically fell into 4 categories, and I'll describe them a little bit. There are other types of programs like physical activity, crop diversification, which have tried to touch on nutrition, but we felt that these 4 are the ones that really have led to the most direct evidence around impacts on individuals, on nutrition impacts for individuals. So the first is around the provision or the improved access to healthy foods in the work environment. This can be anything from a canteen to a fair price shop to a vending machine, depending on the work context. The second is around nutrition education or behavior change, providing information to workers on what is good nutrition and why is it important. The third area which has shown impact is providing health checks to workers in their work environment, looking at things like BMI, anemia status, cholesterol, diabetes risks, and then providing counseling to workers on what they can do to address any issues that they might have. And then the fourth area is around providing a breastfeeding-friendly work environment for women who are returning to work, hopefully with a 6-month maternity leave policy to enable exclusive breastfeeding, but also allowing for lactation rooms and breaks and flexible working hours so that women can successfully continue to breastfeed up until 2 years. And when you look at all of these in combination, they're more powerful. Now, not all of these workforce implementation areas are relevant in all work contexts, but in as much as possible, we would encourage employers to adopt as many as possible. And the evidence does show, I encourage you all to look at the briefs that we've developed, but the evidence does show that there are impacts on not only a healthier workforce, but also lower rates of absenteeism, presenteeism, which is being present at work and your ability to engage and be productive, more satisfied workers, higher productivity, and then some have been able to show returns on investment. And I think that the breastfeeding research around breastfeeding support at work is probably the most rigorous data, the most rigorously applied across multiple contexts. So I want to speak a little bit about a couple of the programs that GAIN has been involved with, and showing the diversity, I guess, in workplace environments and worker types. One of our programs is in Bangladesh, in the garment factories, and we have been working with ICDDRB helped us do an evaluation, and we were working with the Her Health BSR program as well, where we provided iron folic acid tablets to women, female garment workers of reproductive age, as well as peer education around nutrition and other topics. So on the right-hand side of the graph, you can see that with those intervention compared to a control group, there was a reduction in anemia of around 12%. I think this is over 6 or 12 months. When we added on top of that the provision of a midday meal that the factories were already providing, but including iron-fortified rice, as well as more of a balanced meal with vegetables, dairy products, etc., we were able to see a decrease in anemia prevalence by 33%, which was quite compelling, and the program continues. Another context in which we work is with tea farmers. And we work in Kenya, India, and Malawi. And I think Suraj will speak a little bit to the work that Ecosiat is involved helping us here. But this really is more focused on behavior change communication and education. And with Ecosiat, we're trying to increase the access to healthy foods on the estates for estate workers. And through these intensive behavior change approaches, we were able to see improvements in the diversity of diets, as well as improved hand washing practices. And since this evaluation came out, which was done with the Sustainable Trade Initiative and Unilever, we have been able to encourage around 7 other tea companies to join the program and to reach more workers in more countries. And I just wanted to conclude just to mention to everyone that we have been working in the past 6 months to a year with the Consumer Goods Forum to develop a Workforce Nutrition Alliance. And the idea here is to bring together all partners who are interested in this area, who have experience in this area, and can share lessons learned, advocate for the importance of workforce nutrition, and help employers to implement programs. We have been doing this as a part of the Nutrition for Growth efforts and the Nutrition for Growth Summit, which will happen next year in Tokyo, trying to encourage employers from not only the private sector but also the public sector to make nutrition commitments. And one of the commitment areas is around workforce nutrition. So you can find us online under Workforce Nutrition Alliance, and please do reach out if you're interested, and I'm happy to take any questions about the Alliance as well, or anything else. Thank you very much.
Thank you so much, Dr. Christine. I think I saw one comment from a participant, very well articulated presentation. So thank you again. So you have received a very, very good rating from the audience.